You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to Protecting Your Nest podcast. During our last episode, we learned from one of my patients, Monique Travis, that a low-carb diet, intermittent fasting, and exercise were effective ways for her to reverse many of the chronic diseases she was facing. Her experience as a nurse, believe it or not, did not fully prepare her for what she needed to know to heal from the chronic conditions she faced. So along her way, she was able to pivot away from traditional medicine to an approach which focused on lifestyle. As you know, that's my big thing. That discussion has put her on the path to recovery, and it's amazing to hear her story. So if you haven't heard that episode, check it out with Monique Travis. Her story made me wonder, what if a doctor is faced with the same challenges? Will they too consider alternative ways to heal? Well, to help answer that question, I have invited Dr. Kristin Baier, who's had her own set of medical challenges. And although she speaks through the lens of a clinician, her story, like Monique's, provides hope for all those who have been told they will never, ever heal. So Dr. Kristin Baier is, someone who has a lot in common with me, believe it or not. And she may not know this, but I think she knows the first part. She's double board certified in obesity medicine and family medicine. That sounds like me. She tried a vegan dietary approach in the past. That sounds like me. I was a vegetarian and somewhat of a vegan for 8 years. And not until recently, she was a resident of Chicago. And I'm still wiping away tears that she's now not in Chicago and she's currently practicing elsewhere. So we have a lot in common. The main thing we have in common is that we believe that food should be the medicine. So she is now here to share her gift of healing with us. And she's doing exactly that in San Diego, where she now serves her patients through a non-traditional healthcare model with an emphasis on metabolic health. That's one of the words I've emphasized over and over again. She specializes in weight loss management through lifestyle and nutrition, and thankfully is both licensed in California and Illinois. So for us Chicago folk who are missing her right now, there's still an opportunity to connect with her virtually, thank God, to technology. So Dr. Baier, you've overcome a lot of medical problems, and you've struggled for years with those problems. So I guess as we get started, tell us a little bit about some of those struggles that you overcame. And just as importantly, when you think about facing like life-threatening medical conditions or conditions that are chronic, what did that feel like? Like you're a clinician, you know what's coming. How did you feel when you were facing those medical conditions?
Hi, Tony. Thank you so much for having me on your podcast. It's an honor to be here. And it's great to be able to talk from a patient's perspective once in a while instead of just a clinician. But my experience has been unique, as yours has, with how we got into the low carb space. For those who are not familiar with me, I was diagnosed with lupus, which is an autoimmune disease, when I was in my second year of medical school. And at that time, just being a new medical student, I didn't know much about lupus, but I did know it's a lifelong battle. There was no cure. Patients have a much higher risk of heart disease, kidney failure or kidney disease, and just appear to have a lot of pain and suffering throughout their lives. So as you can imagine, getting that diagnosis was a little scary. And I thought, well, this is a great time for me to learn as much as I can, not just about lupus, but about autoimmune disease, and see if there were any alternative treatments out there. Most patients with lupus are on immune modulators, and quite frequently on steroids. And anyone who's been on a prolonged course of steroids, specifically prednisone, knows that one of the most common side effects is weight gain. And in my mid-20s, that sounded like the worst part of the entire diagnosis. So I immediately started doing my own research into the nutritional world. And one of the first books I came across promoted a vegan diet to treat autoimmune disease. And I thought, perfect. That's what I'll do. I will become vegan and I will be just fine. So I fully embraced a vegan diet for about 5 years. And during that time, my symptoms actually became much worse. And in addition, I developed debilitating anxiety, depression. I was so irritable and hard to be around. I also had a B12 deficiency, and I developed horrendous migraines that were just completely knocking me out every time I experienced one, which became more and more frequent. So, that was kind of how I got into the nutritional space, as far as trying to use food as medicine. And it didn't take me long to discover the work of Rob Wolf, who promotes a paleo diet for autoimmune disease. And after 5 years of being vegan, I realized it was not doing me any favors. And I transitioned into more of a paleo, and that led to keto, and that led to a more carnivore approach. But it was much longer than a 10-year process of trying to figure out which diet works best for me and could potentially heal my symptoms of autoimmune disease.
Yeah, that's interesting. I definitely echo a lot of your sentiments around wanting to look for a solution. And I became very good virtual reading and looking at the research of Dr. Ornish and Dr. Esselstyn, all those folk who I had tremendous respect for and still do. And I think but I didn't compare what they were saying to other approaches. So my brain hadn't done that. And then when I actually started looking beyond just that, that's when I discovered there were other ways to get the job done. The good news is for some people, the approach that's more vegan or vegetarian works just fine. So I think that if that works for a person, that's why it's a little bit of an experiment, which is kind of what you did. And I think we have to just be open to changing direction. So if Tim Noakes, Professor Noakes, can change direction like he did, you know, we can change direction as well. And that's why people like that are like my heroes, because they're not afraid to say, I may be wrong about these carbs, and maybe as a runner, I shouldn't be carb loading and doing things like that because my diabetes numbers are not right. So that's really interesting. I am curious, and I'm sure a lot of people who maybe are not clinicians are wondering, you're a doctor, don't you go to another clinician to find help? Why are you going into this homeopathic space? What made you do that first? Or did you actually go to a conventionally trained doctor first before you decided to go a little off the path?
That's a great question. So, my primary doctor diagnosed me after I had realized I was having just textbook symptoms of lupus for about a year, that I kind of brushed off and thought was due to regular fatigue from medical school. I thought my malar rash was rosacea. I thought my joint pains and muscle aches were from working out too much. So my primary doctor diagnosed me and immediately referred me to a rheumatologist who specializes in these autoimmune diseases. And I met with the rheumatologist, and he was great, but he really didn't offer anything other than medication. So, and I don't blame him at all. That's how he was trained. That's probably what I would have done if I were in his situation. But I just wasn't satisfied with that. I wanted to do everything I could in my control to help modulate this disease, and I didn't feel medications were the only answer.
That makes sense. And it sounds similar to my journey. Although I think I probably dove into the space of let's find another path fairly quickly. But I kind of knew from what I had learned that, man, there's got to be another way. And it's really interesting how we become insightful like that. And I actually try to think that way for my patients too. I think they would want alternatives to medicine if it's possible. And I do believe that we're both probably integrative in the sense that we do integrate. If you need surgery, you need surgery. It's no way
Mhm.
around that. So it's just certain things we have to be thoughtful about. So, and I know when I converted to the low carb, high fat diet, I did it partly because I was already doing a vegetarian diet and my hands were aching. I'm like, what's going on here? I was having stomach issues. But when I reflected back on that, and as I'm training for nutrition right now, I noticed that maybe my stomach was more of a leaky gut issue potentially, and maybe those large proteins that shouldn't be absorbed, those peptides, maybe they shouldn't be absorbed, and they're being absorbed, and they get into my body, and then they increase my risk for inflammation. So I was thinking about those kind of connections as I thought about myself, and I was wondering, as you think about yourself and lupus, was there anything you could go back to that you feel may have increased your risk for an autoimmune disease from the past?
Yeah, that's an interesting topic. Before I was diagnosed with lupus, I really hadn't heard anything about leaky gut syndrome. I'm sure as you were, I was taught that we don't really know the cause of autoimmune disease. There was some talk about it maybe stemming from a viral infection and being a mix of genetic predisposition with exposure to certain environmental toxins or pollutants or infections. But as I learned about leaky gut, I thought this makes a lot of sense. It really does. I had some digestive issues. I was never diagnosed with celiac, but I absolutely had uh, bloating and just dyspepsia, just a lot of trouble digesting grains. And I think that when I look back was a big contributing factor that maybe that compromised the integrity of my gut lining and even the gut microbiome as we're learning more and more about that. And I can't say for sure, but I do suspect that my inability to properly digest and metabolize grains did contribute to some of the leaky guts components that could have triggered my lupus symptoms and
Yeah,
ultimate diagnosis.
it makes sense. And that's the irony of that is that the grains are really pushed for fiber, which again, there is logic in that. One of the things I noticed when I was struggling with, trying to find the best answer is the irony is that with the standard American diet, I did feel not so great. And then when I did a vegan vegetarian, I felt much better. So I did feel better. But what I always had was the gas and you're afraid to eat the broccoli because it's going to bother you. And then if you take the Beano, maybe it'll work, maybe it won't work. But there's something to our body's ability to kind of tell us some things, like maybe that's not exactly the best thing for you. And again, you have to listen to your body. Some people eat these things and it doesn't bother them at all. And what I believe and what I'm learning, that's why I like nutrition and functional medicine. And I'm studying that now. What I like about it is that it is about root cause and to say, in fact, check this out. You won't believe. So I'm studying for a final for Friday, right? Which will be the day this podcast is released. And I went through the rheumatology section, and every single one of them said, we don't know what the cause is, just like you just said, like every single one. And yet I just believe there's always a cause, so I just feel like we have to ask those questions our kids ask, why, and just keep asking why. And if we don't know why, we say, here are a few hypotheses. And I think if we can integrate the things we're learning from these more homeopathic functional medicine sciences and integrate that into the conventional, I think we'll have an extraordinary opportunity to identify more reasons why people get sick and therefore find ways to help them. So I'm curious if you could just briefly express, did you have the same experience? So when you went, from a standard American diet to vegan, you felt better, I'm assuming, and then you did paleo, and then you did carnivore. And is this carnivore diet so far the best you've experienced? So tell me a little bit about those different diets in terms of how you felt physically.
Sure. So when I was vegan, or I should say prior to vegan, I was eating a standard American diet, very high in processed refined carbohydrates, high in sugar. And I transitioned to vegan pretty abruptly. There was no vegetarian to vegan. It was overnight. I decided to become vegan. And as I'm sure you know, you can still eat a lot of quote junk food or processed refined carbs while you're vegan. And that's exactly what I did. I did not improve the quality of my diet very much. I did
It's
probably
called pasta, right?
Yes, yeah, exactly,
Right.
exactly. I will say I probably did eat more vegetables. I ate so much peanut butter. I felt like I was always hungry while I was vegan. So I actually am probably one of the few vegans that gained weight, and it's largely because I just never felt satisfied. But there was a time, like maybe the first year or two, where I didn't really feel any different, I would say. The biggest change I noticed with a vegan diet for me was my mood, and I became incredibly irritable, very snarky, very short-tempered, depressed, anxious, and at the time I didn't realize it. I attribute it to being in residency and, "Oh, I'm sleep deprived and overworked," and, I just thought that was the reason for my symptoms, and then my during that time, my lupus symptoms were getting worse, and I was on and off of steroids quite often and just really not feeling my best. So I started to question if the vegan diet was really doing me any favors. I didn't have much to compare it to. So back to the books and research, and like I mentioned, Rob Wolf it does a lot of great things for autoimmune disease, and through his own experience has learned a lot. And I decided maybe it was time to give something else a try. So I went to paleo, and I started back with chicken and maybe some seafood before I added red meat back in. But within a couple weeks, I felt so much better and my mood improved drastically. So I'd say transitioning from vegan to paleo was really a very life-changing experience and great for relationships, great for my work, and just everything. My autoimmune symptoms slowly started to improve from there. They didn't go away completely, but they definitely improved. And I realized, I was on prednisone much less frequently, smaller doses, just my energy was much better. And then I still could not manage to figure out my migraines. While I was a vegan, I started to develop horrible migraines. And eventually I read another book called The Migraine Miracle by Josh Turknett. And that was the first time I heard of a ketogenic diet. And I did research for quite a few months before I implemented it. As you know, we were taught fat is going to cause cardiovascular disease and this diet is going to kill you. So it took me a couple months to retrain my brain and to learn on my own, not go by dietary guidelines and what we're taught in medical school necessarily. But when I implemented a ketogenic diet after feeling comfortable enough that it is safe and it is healthy, my migraines went away within a couple weeks. I went from being on 4 different medications plus abortive medications um, to being able to wean off of all of them pretty quickly. And then after a couple months, I noticed, wow, my autoimmune symptoms, primarily joint pain and fatigue, really improved. And I hadn't been on prednisone in a while. And since that time, since I made the decision to start a ketogenic diet, I have not been on prednisone at all, which is absolutely remarkable. So that kind of, I feel like keto, I tell people, keto's the gateway to carnivore. You feel so good when you're on keto, especially if you have autoimmune disease. And then you feel like maybe I can improve just a little bit more. Maybe I could get off of my Plaquenil and daily medications, and just see what it feels like. And I eventually gave carnivore a try, and it's hard. I'm not gonna sugarcoat it. It's a very restrictive diet, the ultimate elimination diet, but I absolutely, without a doubt, feel best when I am doing a carnivore diet mixed with time-restricted feeding.
Cool. I'll definitely ask you a question about elimination diet at some point, but I was listening to you and you mentioned peanut butter, so we have something else in common. I've always been a big peanut butter fan, and I struggle. That's one of those things that if you leave around and you have access to it, it's hard to stop, you know?
Oh,
I
yes.
I struggle with those, you know. So we have that in common for sure. And but interesting enough, another thing I was reading recently is that you have these 8 allergens, things like eggs and things, but peanuts are right there, So it's
Mhm.
possible that as much as we love them, they may actually also contribute to some irritation in our gut, and part of leaky gut is not just absorbing, peptides or proteins that are too large that shouldn't be absorbed that cause inflammation, but also absorbing things that can increase your risk for allergies. And so I think that there's a lot of things that the leaky gut knowledge is going to be helpful. And like you, I didn't learn anything about leaky gut in medical school that I can recall. And I also think about the mood issue, and I've mentioned this before, but again, those folk like Sean Baker and Dr. Kim Berry, those guys have also, applauded their dietary change as improving their life when it comes to their emotions. So it's good to know that that kind of side effect that you weren't expecting
Yeah.
occurred. I love that. So that's excellent, and anyway, I think that's great. So we're talking about how we are benefiting personally, but we also are here obviously to help our patients. So my question, with both of us having this vegetarian/vegan background, so you have a person in front of you who is a vegetarian or vegan, and some of them are going to be doing great, and some of them are not going to be doing great. And then you have a doctor that's, basically a carnivore. How do you approach those conversations in a respectful manner?
Yeah, that's a great question. And I am a firm believer that one dietary approach does not work for the entire population. There's a great deal of bio individuality. And if a vegan or vegetarian diet is working for someone, they feel good, they have energy to get through their day, they have mental clarity. I am in no position to tell them to stop doing that. I might guide them with some supplementation, especially if they're vegan, but I completely respect people's personal decision on how they want to eat. If it's a religious reason or if they believe it's more ethical, whatever the situation, if it's working for them, I fully support it. On the other hand, if it's not, we need to talk about why it's not working, what type of problems they're having, what type of symptoms, and what kind of dietary changes might be beneficial for them. And I'm sure as you experienced with the vegan diet, it kind of becomes your identity. People know you as the vegan, and when you go out to eat and you socialize and you're with your family and the holidays, they expect you to be vegan, and it almost becomes a part of you. So trying to reintroduce meat or even eggs or dairy, there's a psychological component as well. And the timing has to be right. I think the patient absolutely has to be open to it. And sometimes they are, sometimes they're not. But I think as the physician, we have to reassure them that whatever diet they choose to follow, we will be there to support them and give them guidance along the way. Even if it isn't what we believe is optimal for our own health, but as the physician, we will do our best to make sure they're getting the proper nutrition, the vitamins, the minerals, enough protein, and everything to accommodate their beliefs and desire.
That's right. I actually talked to a patient today who has been a smoker. He's probably 68 since he was in his teens, and he's one of my favorite patients, but he still smokes, you know. But like you said, he's one of my favorite patients. I'm there to coach him, be his buddy, encourage him, not talk down to him. Even I think today what we said is this is probably one of the most addictive substances on the planet. So it would be insane for anybody to be demonized because they struggle with that. So yeah, but I agree with you. I struggled with this label. 8 years as a vegetarian doctor, and I was known as the vegetarian doctor. And so I'm now seeing people who, because of insurance or other reasons, did not see me for a while. And they come back and they're like, Doc, I just want you to know I've been a vegetarian for 5 years thanks to you. And I'm like, it's like, and when I tell
Right.
them I'm doing something else, they're like looking, it's like deer in the headlights. And it's like, oh my God. So yeah, so it's a weird feeling. But anyway, either way, if they're doing well with that approach, then it's a good thing, and we roll with it. So, but that happened to me. So again, we have a lot in common. I don't know how that happened, but we've had some very similar life experiences, and I did not know that until I started doing a little research, and then of course talking to you today is kind of crazy. So, one more thing I want to touch on that's different. So in my training, like we just both said, I didn't know anything about leaky gut. I certainly didn't know anything about an elimination diet. And so I don't know if you've heard this, but when I was in my functional medicine course, they talked about when you have a person who's allergic to everything, what should you start with and what they recommend. And I'm not sure why pears. So you start with pears, lamb, and water. And you do that for, I think it's 5 days or so. And then you start to add things back from there. I'm not sure why pears, but that's what it is. And so, and I used to be a big fan of pears. I'm more of a berry guy. So I'm curious, where did you learn about elimination diets? And do you make that part of your strategy as you approach the care of your patients?
Right. That's a great question. And that's interesting about pears being part of the elimination diet from a functional medicine standpoint. I'd be very curious
I
to
know.
know.
I'm gonna
Yeah,
ask
you'll.
my I'm gonna actually try to get my one either. I'm gonna try to get one of the functional medicine teachers or deans to come to the podcast. They tend to lean more towards a vegetarian lifestyle, but it'd be interesting to ask a few questions, like just to compare notes and really just to broaden the conversation a little bit. What I don't want this podcast to be is just low carb everybody. I want us to kind of have a discussion and talk about, not a debate, but more of a, here are the reasons why I choose this path. And then I can say, here are the reasons why I choose my path. And then people can choose.
Yeah, I love that approach. Exposing people to different perspectives and theories, I think is wonderful. And people have the option to decide what works best for them or to do some N equals one experiments. Um, but to answer your question, I think it was probably when I was learning about paleo diets that I started to become familiar with an elimination diet. And that was really with the paleo autoimmune protocol, which is pretty restrictive. You eliminate all grains, dairy, nuts, and seeds, plus nightshade vegetables, which are your eggplant, peppers, tomatoes, and potatoes. So, that I would almost say is a form of an elimination diet. And when you start the reintroduction phase, that's when you really get your information. And the question I always get is, well, how long do I have to stay in this elimination phase? And
Right.
I usually recommend a minimum of 12 weeks, and then it's a
Yep.
very slow reintroduction
Yeah. I
process.
think we learned 8 or so in my class, but that sounds about right.
Yeah, yeah. I mean, more than a week or two, which is what people want to hear typically. But yeah, I think eight
Right.
weeks seems reasonable. But to be honest, it was kind of getting into the keto and low carb space and community where I started following Paul Saladino and Sean Baker, and started to become familiar with a carnivore diet. And I thought, this makes a lot of sense. Same operating system almost, and not having the anti nutrients we find in certain plants, the lectins and phytates and all of those things. So it started to make a lot of sense to me, and especially when you believe a leaky gut might be the root cause of your symptoms. Um, so it's a challenge. I'm not going to lie; it's a challenge to do a total elimination diet, and there are different versions. I'm a big fan of Dr. Will Cole, who's a functional medicine doctor, and he's written a couple great books. On elimination diets as well, and the inflammation spectrum is one of them. And his version of an elimination diet is not nearly as restrictive as carnivore. But I do think if people have tried all the other options, they're not getting relief, or they're not getting complete relief from their symptoms. I do think carnivore is the most restrictive diet, or the best elimination diet to really try to get to the root cause and then do a reintroduction to identify what could be going on.
And I like this idea of looking. I'll be honest. I don't know that I fully. I think I probably heard Dr. Kim Berry connect like the diet that's carnivore to an elimination diet. I hadn't really thought about it. And then I heard him say it, and I said, I guess that is an elimination diet. 'Cause you pretty much eliminate everything. And a lot of people listening, part of why that diet probably works so well is because you eliminate all the things that you potentially can ingest that'll harm you. So even if you think about those 8 allergens, like the eggs, and even though eggs are okay technically, but the nuts, seeds, and things like that, you eliminate all that stuff. So it's kind of, you're just left with nothing that can bother you. So I think even as you articulate the terminology, and we've mentioned leaky gut and elimination diet, and then you throw in the mix other terms that some people hadn't heard of. As a physician, I didn't know what a phytate or a oxalate was, and those things that are in vegetables and things like spinach that will protect them. I think oxalates are known to be in spinach, so it protects them from us. And so, if I get one of my colleagues from school to come aboard, they would say, well, you need these things to challenge your body so you can get a stronger immune system. And then carnivore will say, well, yeah, but you're causing, maybe a lot of irritation, and maybe that's not really good for you. So I think that's a good conversation to have, which is not a yin and yang. I don't know which one is right, but I think going back to that term, bioindividuality, I think it just depends. I think that certain bodies are going to react differently to certain exposures than other bodies. And in some cases it adds value, in other cases it doesn't. So I think it's back to experimentation. So one of the things that come to mind when you think about you leaving Chicago and practicing in sunny California, and I'm definitely jealous. So I just want to say that. What could you say about the previous setting you were in that you would like to see done differently? And I want you to say this in a loving, politically correct way. So
Of course.
yeah, what's wrong? Like, I'm in a large, Advocate Aurora is a large
I
health system,
mhm.
obviously, in Illinois and Wisconsin. So, that's where I'm at. So what could my health system learn from the experience you had that, kind of made you want to make a change?
That is a great question again. And one I could probably spend hours unpacking, but I'll try to give you my politically correct abbreviated version.
That's right.
Um, for those who are unfamiliar, I am now part of a direct primary care and medical weight loss practice with my partner, Dr. Brian Lenskis. And direct primary care is a cash based membership model. So we do not take insurance and we are not part of a big healthcare organization. We're a small independent practice. And where I came from in Chicago, I was working for Edward Elmhurst Hospital, which is smaller, but it's still a healthcare system run by hospital administrators. And prior to that, I was with another organization, and I did my training at University of Illinois at Chicago. So I had been part of the mainstream healthcare system for many years, and I guess I became disheartened with how little time I had to spend with patients and how much of what we were supposed to be doing was dictated by certain metrics and reimbursement and what the hospital administrators wanted from us and what the insurance companies wanted from us. And I found there really was not enough time to dive into nutrition and preventative medicine with patients. And I was struggling because I wanted to really emphasize lifestyle. And when you have 15 minutes with the patient, that's barely enough time to even talk about what they're eating. So, what we do now in our direct primary care practice is we have a model set up where we cap the number of patients that we have. We don't have anyone over us telling us how many patients we need to see. And it allows us to spend a lot more time. Like the initial appointments might be an hour long, where we can really get into the history and take some time to teach them about dietary choices and stress management and sleep hygiene. So my overall thoughts are just the way insurance companies pretty much dictate how hospitals are run, how doctors are supposed to practice, is problematic when it comes to preventive medicine, which is ironic because the insurance companies will win if their customers stay healthier, right? And
I
if they
know.
focus on prevention. But
I know.
that it's unfortunate, but maybe it will change. Who knows? But right now, I guess I was just burnt out and really wanted to focus on preventive medicine and nutrition, even if that meant a change in location and a pay cut. Like it's makes me feel much more satisfied as a physician to know that I'm really helping patients and to have patients who are so appreciative. It's really changed the way I feel and practice medicine, and it's been great.
I remember. Is that beautiful system? I mean, I remember driving by and seeing this beautifully rebuilt, either I think it was a hospital. Was that hospital recently rebuilt? Like
It
not too
was.
long ago. It was so
Y
beautiful. Oh my
yeah,
God.
it's a gorgeous facility.
Oh my
I
God.
mean, they
Yeah.
have fountains and orchids, and
Right.
it's like I mean, it is beautiful, I'll give them that, that's for
Yeah.
sure.
Well, I just wanted to say that I remember driving by, 'cause I lived in Oak Park, which is, for those listening, just right outside of the city, west of Chicago. And but Elmhurst is not too far from there. It's very similar suburbs in terms of the type of community it is. But yeah, that's one of the most beautiful hospitals I've ever driven by. But I do think you said it politically correctly, so thank you for that. And I do
Of
have
course.
some good news. We're working on, in our health system, we're working on a weight management program,
Oh,
and some of the
great.
people on the team, yeah, it's really good news. And some of the people on the team are board certified in obesity medicine. So I wanted to ask you, I don't know that a lot of people are aware, and I've mentioned it before. Not a lot of people are board certified in obesity medicine. So and I'm not even sure if we've made 4,000 docs so far. I know it was in the 3,000s the last time I checked, but we need to get more people doing that. But having said that, it's not perfect. So my question for you when you think about that training, is there anything about that training you think that would be better if they had done it differently?
Right. So it is a growing field, and I'm so happy to hear that Advocate Aurora is implementing a medical weight loss program. That's fantastic news. And the training for obesity medicine, it's rare. It's a specialty that doesn't require a residency to sit for its board exam. So a lot of it is self study, which is good. In attending conferences, it allows physicians who are actively training and or working and seeing patients to be able to study on their own time and schedule. But it is a lot of I don't know how to say this politically correctly. I guess it's I my interpretation was a lot of narrow-minded thinking. Kind of just strictly following the guidelines and then
Right.
teaching medications. And don't get me wrong, there's definitely utility for the medications. Some of it was excellent too, how to manage surgical patients and addressing some of the psychological issues. But it very much, in my experience in the training courses that I took, it was very much calories in, calories out. When I went to a conference, through Blackburn at Harvard, they definitely were not in favor of time restricted feeding. They were not in favor of low carb diets or a ketogenic diet. And I thought it was a little disheartening for these thought leaders in the weight loss community to be disregarding something that had so much research behind it and good studies behind it as well. But that's the beauty of being an independent practitioner now. I can do my own research and implement the practice that I would like to. Whereas before, I would get some pushback from doing things that weren't part of the standard of care necessarily, or part of traditional medicine, and almost being penalized for being forward thinking.
Yeah. Well, I think they will get it eventually. I do remember a
Yeah.
mixed bag. And one thing I will say, I I don't fear medicines like I did ironically. So I actually feel more comfortable with medications because you kind of know what they do and what they don't do. However, I don't know, I promise you, I probably got, if I got 5 people on medicines for weight loss, that's it. Like, I just don't use them because the time restricted eating and the low carb or keto diets work to reduce their appetite.
Yes.
So the medicines, why do you need the medicines? You know what I mean? It's like it does it for you. And I'm sure
Yeah.
you've had a similar experience, you know?
It's so true. During our initial consultations with patients, I always ask them if they're interested in anti-obesogenic medication or weight loss medications. And I do it just to gauge where they're at.
Right.
Some people come in and they want a prescription and don't want to do anything else. But I will tell you 95% of my patients say they do not want medication. They want to do weight loss through lifestyle, which makes me so happy. But there are certain situations, and I think some of the medications are safe and effective.
That's right.
And it's again like dietary approaches. It's not one medication that's going to work for everyone. Sometimes it's trial and error. So I do think the obesity medicine boards did a really good job of teaching us about the medications. I will say I did not know much about them prior to
That's right. Me
studying,
neither.
so that was very nicely done.
Yeah, that's good. And well, again, I definitely don't regret getting in. I definitely feel more comfortable talking about the subject because I have the extra training. So I definitely want to encourage people who are listening to still move in that direction. You know, you have to get the education somewhere. I also would recommend, something like the Diet Doctor's free CME that shows us clinicians how to do that work in the clinical setting. And Low Carb USA has training. The Tim Noakes Foundation has training. So there's places where you can get that knowledge if you just want to go a little deeper into the weeds. So you may have to consider the board's certification. So one of the things I like about teaching time restricted eating and low carb and is this ideal of metabolic health. And when I get by the way, for everybody listening, I finally got my website up. I think I went through 10 episodes without a website, but on a podcast, but their website's up. So it's drtonyhampton.com. Just spell out the doctor, and hoping to partner with a diet doctor to have some recipes on the site as well. But I brought it up because the title at the top of the website talks about metabolic health, right? And how the nest and the rope help achieve that. And then I heard a recent study that said 88% of Americans were metabolically unhealthy. So you've mentioned a few things that you've benefited from, but as a clinician, beyond the things you've benefited from personally, what other health conditions have you really seen turn the corner when people eat this way?
The most effective diet I have seen for diabetes type 2 has been a low carb diet. So I would say diabetes by far and away just has outstanding results when we change to a low carb, whole foods based diet and add in some intermittent or time restricted feeding. High blood pressure usually resolves quite quickly as well. Dyslipidemia, specifically high triglycerides and low HDL, improves pretty quickly. I've seen the LDL pattern switch from pattern B to pattern A, which is less of a cardiovascular risk factor as well. And anxiety and depression also improve or completely resolve. But I'd say those are probably the top things. And then we've definitely seen improvements in type 1 diabetes, skin conditions such as eczema and psoriasis, which can be which is autoimmune as well. I do have a handful of patients with migraines who are doing quite well on a ketogenic diet, but there's so many things, and I feel like every day we're kind of seeing new and new patients or new situations where things we had not previously considered to be dietary related that are improving. And that's really the exciting part. I'm very much interested in its role in cancer prevention and as an adjunct treatment, Alzheimer's prevention and treatment, Parkinson's, all of these neurological diseases, even post-traumatic stress. We're seeing a lot of improvement, which is just incredible. So there's really no limit right now. I feel like we're still learning so much. This is just in
Yeah,
its infancy
just
of
getting
what it can
started.
do.
Just getting started, and maybe somebody will talk you, me, and your partner in San Diego into doing some research at some point. We got to keep building a case, and I think that we'll have plenty of examples of people who have done really well. So that's something that I think is, in fact, as I even say that, I'm thinking about, how do you get other clinicians to have the courage to do this work? And I'm kind of trying to work within my system to help provide a different perspective. And I think they're listening because we're making progress. And certainly I'm not the only person that's standing on the rooftop. I'm curious if you had a young doc who's just getting started, and you were mentoring them, or even a more seasoned doc who's frustrated and not, happy with how things are going. What kind of advice would you give them to give them a path to maybe doing things a little differently?
So I think the first thing I would suggest is becoming an expert in the field of nutrition, or at least low carb diets. Read all the books, go to the websites, listen to podcasts, become an expert. And then what I would do is dive into the research and keep a little section of your laptop dedicated to randomized controlled trials, observational studies, anything, meta analysis that supports what you could do in a practice. And I think a barrier for a lot of physicians is going against the standard of care or going against what's mainstream. And low carb is definitely gaining traction. It's recommended by the American Diabetic Association now is a dietary option for diabetics. And it's becoming more in line with the standard of care. But I think knowing that your license is going to be protected, that you have research to back up what you're doing, provides a lot of peace of mind. And I think once you've really understood the chemistry, the biochemistry, the physiology behind a low carb diet, it's pretty easy to defend using it for your patients. And I would start with some, and I'm looking at this from a primary care physician's perspective. Start with a patient that has been unsuccessful with conventional weight loss methods, calories in, calories out, and maybe someone who's a type 2 diabetic. If you start implementing a low carb diet in those patients, you are going to see success so fast. You're going to be weaning these patients off of their blood pressure medications, off of their metformin, off of their insulin. And it's going to give you the confidence that this really does work. Your patients are happy. They love seeing you. They're getting healthier. Just the job satisfaction rate goes up. Everyone is winning across the board there. And I think if you slowly start to implement it, start with some easier cases, it's going to give you the confidence to really pursue it. And then you're going to start to evolve your thinking and realize that it's crazy that you're not offering this to more patients, and it'll be a natural progression.
That sounds great. And I think I'll have to do a little bit of a commercial again. Number one, the metabolic multiplier. I have a link on my website, and they have a link to all the really good low carb, keto friendly resources, one of which is Diet Doctor. Now, Diet Doctor, if you Google, what I thought about is I have a section on my website that says Diet Doctor. So I'm going to actually, when you click on that, there's a few links to things of value, but I think I'm going to also add a section, evidence-based low carb resources, because they do have if you just Google Diet Doctor and evidence-based low carb research, they actually have all of that stuff right there for you. And then I think under Metabolic Multiplier, they have things like Verta Health and other organizations that are doing research. And that way you can kind of start there. You can maybe read certain books like Gary Taub's book, Good Calories, Bad Calories, etc. And the funny thing about this is you learn a lot from a journalist who wrote a book, who did an investigative, journey, and then they figured out things that helps us do our job. So I really think that I like what you're saying. Let's add some knowledge so that when you're facing a patient who's asking questions, or you're talking to a colleague who's curious, you have something you can say to them. So that's really going to be really important. So I don't know so I've asked you about the clinician, but what about the patient? So you're trying to convince them to consider keto. Is there kind of an ace in the hole, or like what do you say to really motivate them to at least give it a shot? Is there something you kind of go to as your go-to message?
No, that I should. Now that you're bringing it up, I guess I have not thought about that. I should work on my elevator speech.
Yeah, your elevator. That's right. We all need an elevator speech, right? So it's just like they actually made us kind of think about that with functional medicine, and I think the term metabolic health. I think having a way of thinking through something that maybe people don't understand is probably not a bad idea. So I guess just put that in the back of that's on your to-do list. I'll give you some homework today, and you'll have that you won't need it for most people, obviously, but there may be that moment when you need it for that person. Or when you're on the elevator and people are saying, what do you do? What's up with this low carb, practice, and you just have like 2 or 3 lines you can tell them that are just straight to the point. And then that way it'll be a consistent message. So I threw that in for free. So
Yeah, thank you. No, I appreciate that. And
that's
I
cool.
also love that you're going to include a link on your website to evidence-based
Yes,
methods and studies. I think that will be priceless. I
it's
think that'll give
huge.
people
Yeah,
a
you
lot
have
of
to.
confidence.
Yeah, people need that, and it's just something that people need. So, curious. This is kind of fun question, really. I don't know if it's fun, but you just started a new practice with a great doc. So is there anything interesting, funny, or just surprising that happened as you transitioned from Chicago to California? And like, as you know, I know it was a big undertaking to start a practice. Anything that stands out that kind of catches your attention, a story you can tell about that experience?
Well, for anyone who's ever opened or started a medical practice, it is a roller coaster ride. It's incredibly exciting and nerve-wracking. Um, it's a lot of work, but it is so fun, and it is great to be able to um, see patients and treat patients the way that you want to without some of the bureaucracy that goes on at other institutions. But it's just, I would say, I don't know if it necessarily has to do with the Chicago versus San Diego thing or just the type of practice that we're doing, but our patients are just incredible. They are so sweet and they're so appreciative, and it's like they've become friends and family. And guess I felt a lot more disconnected when I was in Chicago, but I don't think it has anything to do with the population. I think it's just the type of medicine that we're practicing
Yeah,
now.
yeah. It attracts. It's like family docs and surgeons. We're all good people, but I think certain specialties attract a certain kind of personality. And then when you get into that specialty, there's if you're surrounded by a certain type of person or a certain group of people, it may affect how even what you become even further. So I think that environment, I know when I'm in San Diego, I'm a little happier, but it may be the 75 degrees that doesn't change all year round. So,
Yeah, I mean,
that thing.
the weather is pretty great, and if you can manage to get outside and get some sun every day, I think it really does boost your
Yeah.
mood. Although I will say I miss the food scene in Chicago.
Oh, yeah.
I do miss
Chicago's
that.
serious food. So it's
Yeah,
serious,
yeah.
yeah. So, I agree with that 100%. So, excellent. Any other like the rules? Are the rules more relaxed in San Diego that'll make this easier, or is it just because when I go to California or places like that, just seems like people are more health conscious. But other than that obvious thing, is there anything else about being there that makes this a little easier, or is it really just you could have done this anywhere?
I think you could absolutely do this anywhere. Yes, San Diego is a very health conscious city. So maybe that helps with I wouldn't even say that. I was going to say maybe it helps us attract more clients, but or patients, but I have a great number of patients that I see for telemedicine that live in Illinois, and I really think any provider could set up a similar
Okay.
practice
Yeah.
anywhere. Yeah.
Gotcha. That sounds like a plan. And I think I think you're probably right as I think about it now. So I just was curious about that. So let's kind of wrap up with uh, just the nest and the rope question: nutrition, exercise, less stress, more sleep, less trauma, more thinking positively. R for relationships, O for organisms, P for pollutants that we avoid, emotions that we obviously care about, and life experiences that we want to, serve us. So when you think about nest and rope for yourself, thinking about the next year with so much change going on in your life, what areas do you need to personally focus on?
Right. I feel like my constant uh, work is in the field of stress management and sleep,
Yes.
which kind of go hand in hand. When I'm feeling
Yes.
stressed, my sleep usually suffers as well. But I have started implementing meditation, and
Nice.
I cannot say enough good things about it. I feel like it's been immensely helpful, and I recommend it to everyone now. But I definitely want to work on stress management, and I think some of what has suffered has been relationships and making time
Yep.
for friends
Yep.
and family
Yep.
through this transition. So that is going to be a priority over the next few months, is making time to catch up with everyone, and especially with COVID making things a little more complicated too. There's a lot of time to make up for.
Oh yeah, and we're gonna enjoy you will see me. Well, a lot of these low carb conferences. I was with Low Carb USA this year. I was fortunate, and I'm not. I know Dr. Ken Berry's conference. I think it would have been in San Diego, but I just know that those conferences will be attended by myself. Trust me, I'll be
Oh
there,
yes.
whether I'm speaking or not. So that's really awesome. So I guess last question is, how do people reach you? So if we got folks still in Illinois want to connect with you guys, or just anywhere, social media, what's the best way to kind of find you?
Oh, great. Thanks for asking. So I would direct prospective patients to our website, which is lowcarbmdsandiego.com, or you can always find me on Instagram or Twitter. I'm more active on Instagram these days, but my handle is doctoring keto. So I'd love to hear from anyone out there if it's just general questions or interested in becoming a patient. Yeah, I'd be happy to connect with you.
Nice. Well, if you are listening to this and you love Dr. Kristin as much as I do, you may want to find your way to the link at below the show notes, because we're going to spend a little bit more time, as is my tradition, on YouTube Live, and we're going to have a little fun, talking about keto, but we're going to talk about fact or fiction and decide which one of those questions we bring up are fact or fiction, hopefully getting the folk who are live to participate in that. So thank you, Doctor, for, just spending some time with me, introducing yourself to my audience, and just, I'm going to call my mom tonight and say, I have a sister you didn't tell me about, because it's like something's going on here.
I
All of
mean,
this stuff we have
really.
in common. It's
It
ridiculous.
it is. It's funny though. I'm meeting more and more people who were vegan who
Yeah.
transitioned to keto and
I didn't know
carnivore.
that. Yeah. Well, I think we're
It's
seeking
crazy.
answers. Maybe that's what it is. I don't know.
Yeah, absolutely. I would agree with that completely.
Yeah. Yeah. So thank you for that. And also thank you for, being part of this next phase. And I'll wrap up with a couple of words. And, today we learned that doctors get sick, and like you, they must literally take charge of their health if they're going to heal. And so our friend decided, she wanted to heal. So as you continue to learn from great docs like Dr. Kristin Baier and her partner in crime, Dr. Brian Lindquez, I challenge each and every one of you to not make this something you enjoy, this podcast. You just, enjoy it while you're traveling from place to place. When you get those nuggets of information, I want you to take those nuggets and I want them to lead to actionable change. So, and someone, maybe even you, who suffers from metabolic syndrome, now has the path to healing. That's what this is all about. So all that is needed is to just get started. So I want you to pause for a moment and think about what you've been putting off starting, and just get started. So I wish you well. And as always, I remind you to continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.